Hello, welcome to another episode of Hair Talk. I am Sharmila, a hair restoration technician, also referred to as a surgical assistant in the US.
Hi, I'm Dr.Chong. Welcome back. Today's episode, we are going to be talking about the role of the surgical assistant. And even though their primary role is to assist in surgery, you're going to find out that the surgical assistant actually knows a lot more in-depth knowledge about hair biology and medicine.
3, 2, 1.
Okay, so Sharmila, would you like to give everyone an idea about how you got inducted into the team here at Terra Medical after you've just joined us as a fresh grad from healthcare training?
Okay, so first, initially, before starting to do everything, it's important for me to know the theories itself. I have to learn and memorize every part of the theory. Then we progress into me being able to observe surgeries when the team is doing it. In surgery especially, every minor details is important.
Exactly.
So I have to keep a lookout for it, and if there's any mistake, it's important for me to jot it down as well. After knowing the theory and also observing, I proceed into trying onto the model, training models. So that's where I actually practice on. Initially, when I first started out, I wasn't really good at it, but after practicing slowly, I advanced into doing to patients with the help of all of my team members, and also with all of the practice, the high volume of cases we have in each week. So that's when I was able to get confidence from the team as well.
Great. And you're doing a really good job now.
Yes, thank you.
Okay, Sharmila, it sounds like your training was really tough. But what do you find really challenging about different aspects of hair restoration surgery in practice?
As we know that surgery actually consists a lot of different parts to it. So during the first part when we are QCing, actually it's quite tiring because we just have to sit in a particular position and just concentrate under the microscope. So at times, our eyesight tends to get a bit dry because we're just constantly looking under the microscope for hours. When going on into implanting part, that is when we have to adapt to really different type of positions. So at times we have to stand, there will be 3 of us over there. We have to make space for each of us and also really get into the correct place, because if not, then the work will never get done. Also, it is quite a labor-intensive job, so we work long hours. We tend to finish 8 p.m. or 8 plus, and the next day we have to come in to prepare surgery again. But nevertheless, ending off with a positive note, we are able to actually give a smile on the patient when they actually discover their confidence back.
Always so positive, this Sharmila. Okay, in this next segment, we're really gonna see how rigorous Terra's theory training has been for Sharmila. She's not prepared very much for this, but what we're gonna do is we're gonna test her on the glossary of hair medicine or hair transplant. There are gonna be 10 terms that she can pick from, and we're gonna number them 1 to 10. Sharmila will pick a number and she's gonna have to explain that term. You ready?
Yes.
Okay, let's try. Okay? You think you're ready?
Yep.
Let's try.
Okay, number 5.
Number 5 will be androgenetic alopecia.
Okay, androgenetic alopecia basically means male or female pattern hair loss. So the name andro refers to male hormones, while genetic refers to genes, basically if you are inherited from it, while alopecia refers to hair loss in Greek, as I guess they want a fancier name. Okay. And by far this is the most common type of hair loss that is treated here in Terra.
Okay, very good. Okay, Sharmila, pick another number.
Okay, number 7.
Number 7 would be dihydrotestosterone.
Okay, so dihydrotestosterone refers to DHT, which is also a male hormone that can be found in either male or female. So DHT actually causes hair loss, and while DHT actually causes the bulb to shrink, and that makes the hair that is growing to be thinner. So this whole process is actually called miniaturization.
Okay, that's very good, Sharmila. Please pick another number.
Okay, number 2.
Number 2.
Yep.
Number 2 is spironolactone.
Okay. Spironolactone is basically it's a medication that is used traditionally to treat blood pressure or heart failure, but it is also used to treat. It is used off-label to treat female pattern hair loss. Because there is a androgen blocking property which reduce male hormone damage to the hair.
That's good. You got it mostly there. That's
Okay.
great. So far, so good, Sharmila. Okay, please pick another number.
Okay, number 1.
Number one is platelet-rich plasma.
Okay, platelet-rich plasma is also known as PRP, which is not commonly found in Singapore, but it's more commonly being found in other parts of the world. So how this treatment works is actually blood is being drawn from the patient's hand, and then with the blood it is being spun in a centrifuge, and then with that sample that we have gathered from will then be drawn out, and that sample is rich in platelets, which will then be injected into the patient's scalp of thinning area.
Okay.
Yeah.
Good. Well done. Okay, you've done very well the last 4, Sharmila. Would you like to pick the last term?
Okay, number 10.
Number 10.
Yep.
Number 10. Okay, this is not an easy one. Number 10, you have to define the term cicatricial alopecia.
Okay, cicatricial alopecia is also known as scarring alopecia. It is caused by a permanent damage to the hair follicles, which is associated with inflammation as well, and it may cause balding too. So and also, for example, like is a FFA. So FFA is actually known as frontal fibrosing alopecia, and also at times there are many other type of cicatricial alopecia as well.
That's good,
Yeah.
that's good. There's a whole range of them, and I think it would be unfair to test you on all of them, yeah? Good, well done. I think Shah has done pretty well, yeah? But if you think she's made any mistakes, please leave your comments in the comments field below.
Thank you for watching this episode on Hair Talk, and if you want us to discuss on any other topics in the next episode, just let us know in the comments down below. Also, help us like and subscribe to our channel.
Bye!
Bye bye.